Lie comfortably on the floor with your legs standing and observe your breathing. Your lungs have the ability to expand in all directions like a balloon if the movement of your ribs and belly and back and chest allow it. Notice how your breathing is right now. Now let's exaggerate the movement of the diaphragm moving downward. Push your belly out like a big balloon or a big pregnant belly. Place both hands on your lower belly to feel the full belly. You're pushing down into the pelvic floor, very much the way you do when you make a bowel movement. That's the movement of the diaphragm going downward. Try this movement many times and pause the video so you can go your own pace. Now let's try the opposite movement of moving the diaphragm upwards. Pull your belly in like you're trying to get into a tight pair of pants, or like you're trying to swell your chest up like a bodybuilder. Let's combine these two movements. Take a breath in, fill your belly with air, and then hold your breath and move the diaphragm upwards and downwards, nice and slowly, and when you need to breathe again, stop the movement of the diaphragm and then try it again. Move at your own pace. When you're done exploring, rest and notice your breathing and any changes that you feel. Lie on your right side with your arm underneath your head and place your left hand over the top of your head so that it touches the right side of your temple. On your exhale, lift your head sideways, your head and your elbow, sideways towards your pelvis. Feel your ribs push into the table, and then keep your head lifted sideways. And in this position, do the diaphragm movement up and down. Take a breath in, push your belly out, and then pull your belly in and go back and forth. Notice when your head starts to lift a little bit more towards your pelvis because of the movement of the diaphragm. Take a rest and observe your breathing on your side. Notice how the ribs expand on the left side as you breathe. Roll onto the front side of yourself and turn your head facing rightward and have your right arm upward towards your face and your left arm down towards your side. And notice your normal breathing in this position. And then when you're ready, take a breath in and fill your chest with air. Hold your breath and then do this diaphragm moving upward and downward. Notice when you push your belly out, how your lower back raises towards the ceiling, and when you pull your belly in, your upper back raises towards the ceiling. Rest and observe your breathing without trying to breathe in any certain way. Has it changed? Gently roll onto your back and bring your knees close to your chest. Place your right hand underneath the left knee and the left hand underneath the right knee. Let the knees widen so that the elbows are pulled long, and keep the knees close towards your chest. In this position, breathe in, hold your breath, and do the diaphragm movement upwards and downwards. Notice that your arms are crossed and it prevents your chest from expanding in the same way. Notice the areas of your torso that expand instead. Pause and sense your breathing. Now bring your legs towards your chest again and cross your arms in the same manner but with the other arm on top. On the exhale, lift your head to look between your legs, and as you do that, you'll notice your arms will be pulled longer. Stay in this position and do the diaphragm movement up and downwards again. Observe that you can push downward into the pelvic floor and upward into the upper back better in this position. Lower your head when you need to rest. You can do the movement again at your own pace whenever you'd like. Now rest with your legs long and just observe your normal breathing. Don't breathe in any certain way. Just notice if your lungs are expanding in more directions because you have more movement throughout your torso. When you're ready, roll to your side and come on up to sitting and sit with your legs crossed and lean back on both hands. Very gently look upward and downward. When you look upward, roll your pelvis forwards. When you look downward, roll your pelvis backwards. And then stop in a comfortable position when you're looking upward and explore this diaphragm movement again. When you're finished, take a rest and lie down on your back. Observe your breathing. Notice if you have a better quality of breathing, a better quality of rest. Notice if the rate of your breathing has changed, and if your lungs are expanding more like a balloon. When you're ready, bring your legs to standing, and let's explore the first diaphragm movement of up and down that you did earlier. Notice if it's smoother, if it's easier to do. And then when you're done, forget about this lesson and go about your day without thinking about breathing. Breathe the way you would breathe if no one mentioned breathing. I am confident that without thinking about it, you will find that your movement of breath has expanded. Enjoy.